Jai. So, today we are reading Dr. Pratibha Shimpi's book, that is Rachana Sarira. So, we will be covering digestive system first part today, which is in BMS first year, first term examination. So, uh, it writes as this. Digestion is a process in which foodstuff is changed by a mechanical and chemical action into simple form which can be easily absorbed into the blood and utilized by various tissues in the body. So, in digestion, when we eat food, our digestive system engulfs the food and then by tract it goes to the stomach, it digests. Then it small intestine, large intestine, it ferments, the nutrients gets extracted, and then after uh, the remaining material which is not absorbed by our body and some toxic wastes are mixed with bile juice that is put out by the body through rectum. It is carried out by several organs in the body. The organs that collectively perform these functions compose the digestive system. Means the total organ system that may be stomach, liver, gastrointestinal tract, mouth, buccal cavity, all the things are collaboratively called digestive system. The digestive system is divided into mainly two types. One is gastrointestinal tract, which in short form is GI tract or named alimentary canal, and another is accessory structures. So gastrointestinal tract composes of all the tract starting from mouth up to the anus. So the organ composed of the gastrointestinal tract is left side, right side, upper position or lower. In through the tract, the organs are mainly mouth, which is food intake; pharynx, where is food is swallowed; esophagus, the tract where the food goes to the stomach; then stomach, a pouch where the food gets digested by the digestive juice, which is acidic in nature; small intestine, where and large intestine. Small intestine, large intestine ferments the food, then took up the nutrients and then move forward. Accessory structures consist of teeth, tongue, salivary glands, liver, gallbladder, and pancreas. Teeth helps to chew the food and break down the food from big chunk to small pieces. Tongue help to aggregate the food through the esophagus. Salivary glands helps to add mucus into the food and make a slimy ball that helps to engulf. Liver produces juice that easy digested by body. Gallbladder stores the juice from pancreas, bile juice mainly, and pancreas helps to enrich or de-rich our blood sugar level and also helps to digest. Before we go to the digestive system, proper one fact about the abdominal cavity should be discussed. That is nine regions of abdomen. So as to get clear cut of various abdominal and pelvic viscera. So nine region abdomen means that we are trying to make the abdomen from the upper side that helps to indicate the structure's position. Introduction. The abdominal cavity is the largest cavity in the body, so obvious. It lodges various viscera of the digestive, urinary and genital system. Means it contains various organ system, that is digestive system, urinary system and genital system. The anterior abdominal wall seems to be the door of the abdominal cavity. So the clinician surgeon attempt to identify the internal viscera through specific parts or location of the anterior abdominal wall, which are called regions of abdomen. For the purpose of describing the location of viscera, the abdomen is divided into nine parts or regions by four imaginary planes. So what we can see the four imaginary planes that is taken as is such a that we are playing tic-tac-toe. This line one, two. So one, two, three, four, five, six, seven, 8, 9. 9 parts. Now we take a look at the 9 parts. That is the baseline, baseline. So first we can make a body. That is, let's make a body. This is human body. Now we are dividing lines. That is 1, 2. This is the left side of the human. So that is left lateral line. Left lateral line. It is right side of the patient. That is right lateral line. Now this line cross across the abdomen. That is transpyrolic. Why pyrolic? That here is your pancreas and here present the pyrolic sphincter in the pancreas. So that is pyrolic region, transpyrolic veins. Now this line is transtubercular plane. Transtubercular plane. Now in the middle of the line, a imaginary line is also passed, which indicates the our pre-attachment of umbilical cord. So here is the pre-attachment of umbilical cord and that is called umbilicus, and the line is called subcostal line. Subcostal line. Now let us see that this is left lateral line, that is right lateral line. So left lateral line contains this part that is left hypochondrium. Similarly, right lateral line contains this part, that is right hypochondrium. Left hypochondrium, right hypochondrium. Now let us see the underneath part of left hypochondrium, that is this part, is left lumbar. Why lumbar? That is the vertical column is present through the structures in parallel to the umbilical line. So that is left lumbar. Similarly, that is right lumbar. With in the iliac region, it is left iliac fossa, and for the right side, it is the right iliac fossa. So left hypochondrium, then left lumbar, then left iliac fossa. Similarly, right hypochondrium, right lumbar, right iliac fossa. Left hypochondrium, left lumbar, left iliac fossa. Right hypochondrium, right lumbar, right iliac fossa. So the both sides are complete. Now come to the middle portion. That is epigastric. Epi means upper. So that is the gastrointestinal region. Now epigastric. Above the gastrointestinal region is epigastric, where you can feel when people say that here is pain or some feasting is pressing in this cavity. So this cavity is epigastric. Now in the lower abdomen region, you see it is hypogastric. The lower part of this gastrointestinal region is hypogastric. Epigastric, hypogastric. And in the middle, see, that is umbilical. Contains umbilicus, that is umbilical. So what we got? We got left hypochondrium, left lumbar, left iliac fossa. Right hypochondrium, right lumbar, right iliac fossa. That is epigastric, that is hypogastric, and this is umbilical. Left hypochondrium, left lumbar, left iliac fossa. Right hypochondrium, right lumbar, right iliac fossa. Epigastric, hypogastric, and umbilical. Now, there are imaginary planes dividing abdominal cavity into 9 parts. Horizontal planes, transpyrolic plane of addition. That is transpyrolic plane. As the name implies, it pertains to the pyrolus of the stomach. It is marked in the midway between suprasternal notch and pubic symphysis. It is marked in midway between the suprasternal notch and the pubic symphysis. It lies roughly a hand's breadth below the syphisternal joint anteriorly. It passes through the tip of the 9 costal cartilage and posteriorly through the body of L vertebra and near its lower border.